This presentation is to help you understand students with autism spectrum disorder. We'll be exploring behaviors and strategies for success. To understand autism behaviors, you have to understand that they can vary greatly. They may have difficulty with social interactions, they could exhibit repetitive behaviors, or struggle with verbal and nonverbal communication. It's important to understand the behaviors in order to provide support and create a positive learning environment for students. Some factors that influence the behavior include sensory factors. This could be undersensitivities, oversensitivities, and sensory processing. So this could be to lights, sounds, and textures. It could cause them to spin or repeat things. And it could also affect their organization and interpreting information. Their environment is another factor. So having a good routine, not having overstimulating environments, so noise, movement, and clutter. The classroom layout is really important. You need clear boundaries, keep it organized, and visual supports like schedules and charts are really key. Some biological factors include sleep trouble, like their mood and behavior and concentration, medical conditions like seizures or gastrointestinal, and dietary restrictions. Sometimes there's sensitivities or allergies. Some common eating behaviors are food selectivity, food refusal, rapid eating, chewing problems, food stealing, and vomiting. Neurological factors include executive functioning, like lights, sounds, and textures can affect that, and focus, a lack of attention, or hyperfocus. Communication is another factor. So that includes expressive language and receptive language. So unable to express or unable to understand. And also nonverbal. So reading body language and facial cues. That can also affect their behavior. Lastly, their interactions. So this is peer interactions. Negativity from peers can lead to anxiety. Teacher behavior. So positivity, patience, and understanding can lead to better behavior. Bullying leads to exclusion and isolation. Things that can trigger challenging behaviors include sensitivities. We talked about the oversensitivities, so hypersensitivity and hyposensitivity. If they're hypersensitive, they might cover their ears or be agitated. If they're hyposensitive, they might rock, tap something, or do something repetitive. Examples might be bright lights that could be very overwhelming. Colorful posters can pose a distraction. Loud announcements can be anxiety inducing. A bell ringing could cause them to shut down, and smells from lunch could make them nauseous. Transitions could also trigger challenging behaviors. Transitions might include things like schedule changes and activities. So, moving from a preferred to a non preferred activity. They don't want to go from playing Play Doh to doing math. SLP is unexpectedly absent. So when somebody that they expect to be there is not there, that's a transition. If your day begins with an assembly, that throws the whole day off. That could be triggering. Communication is another factor that can trigger this behavior. If they cannot communicate their expressive language, then it can lead to frustration. And receptive language, understanding things, could lead to misunderstandings. So this in the classroom would look like unable to understand directions, and then outside of the classroom, you might be withdrawn from a discussion or unable to communicate with your peers. We all want to support our students. So we can support our students with ASD in the following ways. Be predictable. Have a good routine and a visual schedule. When they know what to expect, that can deter a lot of the behaviors. Modify the environment. It's really nice to have a quiet space for them to go if they're feeling hypersensitive. This gives them a cool down area. Visual aids help them see that they're actually making progress or see what exactly needs to be done next. Promote inclusion. Educating peers is so important. When the peers understand how to help the student with ASD, they can be more help than the teachers themselves. Having a positive attitude when you have these students in your class is huge because it reflects onto all of the students in the class. Having positive communication is really important. So keep it consistent and straightforward. I have keep it simple, but it's not really simple. It's just simplified. So give things in multi-step directions if you need to. Don't use a lot of words. Get rid of all the extra words, the fluff words. And don't use figurative language because they have a really hard time understanding things that are not concrete. Encourage the use of their communication device if they have one. It's not always like an iPad. Sometimes it's a different form. Sometimes it's ASL, but whatever form they use, encourage it. Lastly, collaborate. Share your insights with the SPED teacher. If you see something in the hallway that's happening with the student, make sure you share that, good, bad, anything. If you see an interaction with another student, say that to the SPED teacher because they will really appreciate hearing how the student's doing outside of the classroom. And you also need to attend those appropriate IEP meetings. If you have a student with an IEP, you should be present at the meeting. That way you understand the goals that the student has and their behaviors that are expected and how to manage them. Here are the references, and thank you for listening.